Hi everybody, I am Dr. Jyotirindra Nag from Kolkata. I am a practicing psychiatrist for more than last 40 years. You all know today is the World Mental Health Day. So in this context, I want to share a few words with you all. In the last 40 years, I have seen an ocean of change in the field of mental health or psychiatry. Due to advent of scientific knowledge, awareness, because of a lot of media and other people are related to this field, trying to educate people and better medication, definitely that's another reason, because in recent years the advent of newer medicines which are more effective and with less side effects. So, mental health is nothing different from physical health. That has to be understood very clearly. We all get different kind of physical diseases, heart, lung, liver, kidney, you all know, different human organs are there, and they get affected because of many reasons, different diseases. So human brain is an important part of human system, human body. So if anything happens with the brain function, then we get certain symptoms which are commonly known as mental symptoms. So there are certain chemical substances in the human brain known as neurotransmitters, and it is the role of the neurotransmitters to control our emotion, our thought, our behavior. And these neurotransmitters, as I said, they get affected because of different physical diseases, metabolic errors, and also, very importantly, for brain it is something unique which doesn't happen with other organs normally. That's psycho-social stimuli. We get different kind of impulses through our 5 receptor organs. For example, we can see, we can hear, we can touch, we can taste. So these are the organs which receives the stimuli. So they can alter this neurotransmitter balance in the brain. So there are a lot of myths about psychiatry. Psychiatry is a science, it's a medical science, like any other specialty, it is a medical specialty, and due to social changes, economic reasons, political reasons, different reasons, we all are under stress. Particularly currently this pandemic, Corona COVID, it has created havoc all over the world. So a lot of people are being affected for this particular pandemic, which is a triggering factor. But it is there in the personality of a person, and this personality, we get this personality structured right from the childhood through our this receptor organs, from the family, from the school, from the society. So what I want to explain, what I try to appeal, please come out of this social stigma about this mental illness. Mental illness is a treatable, controllable, curable problem like any other physical disease. It is a physical disease. And early intervention, the more quickly we can take appropriate measure to control and treat these problems, the result is definitely better. Once it becomes chronic and there are structural damages in the brain because of the chronicity of the illness, then it becomes a more difficult problem. So for this reason, I appeal to everybody in the society, the person who is suffering, the caregivers, the family members, the friends, the associates, the society, to come forward and share your problems. There is nothing to hide, nothing to shame, and it's not that it's a genetic disease all the time. More likely it is because of stress-induced acquired problem which can be solved by adherence to the treatment. Treatment is not only medication. Medication, yes, for some time, in some cases it is important, it is necessary. At the same time, counseling, supportive therapy through a properly qualified counselor, a psychologist, as well as from the members of the society, in the family, in the neighborhood, in the office area, in the job area. Everybody has got a role to play. Only thing is that particular person or persons who will give support to this person, the patient who is suffering, should know how to give the support and what are their duties and limitations. So on this important day, again I appeal and I request everybody in the community to come forward and please share your problems with us. We all are here to offer our service either through a hospital or through private clinics or through institutes. In whatever capacity it is possible and acceptable for the person who will be taking the service, it is there. It's there in the hospitals free of cost, in the institutes, or there are private clinics. Lot of avenues are there. It depends on the capability of the person and the acceptability of the person. So all the best in today's important day. So let's come forward and let's treat this particular problem which is costing a huge revenue for the country, for the government, because we are losing working hours from that person who could have produced a lot for the society. So it's for the personal benefit, benefit of the family, as well as benefit for the whole country regarding our growth. Thank you very much.